let's talk about your third trimester. During your third trimester, at around 8 months, your baby will be around 6 pounds and between 18 and 20 inches long. And at this point, your baby's grown and developed until your intestines, stomach, and lungs are starting to have pressure put on them. Between 8 and 9 months, this just becomes more intense as your baby puts on weight and does its final development. And really, the last month of pregnancy is really the month in which your baby's preparing to be born. Everything really has been developed at that point, except for the final maturation of the lungs in some cases. And the main thing that your baby is doing is putting on weight in preparation of being born, because your baby is born with a week's worth of reserves. It can actually develop a nice intestinal flora over the first week by receiving colostrum from you through nursing. And before your milk comes in, and this is what we discuss at length in our childbirth class and breastfeeding classes. So definitely watch our breastfeeding and childbirth class videos, as well as consider getting our ebook, the Natural Pregnancy and Childbirth Advice ebook, because that includes a lot of information about what happens and with your baby's development. But just to give you kind of an overview, by the time you're full term, in between 8 and 9 months, that's when your baby is putting on another couple pounds and growing the last little bit. On average, babies are usually 18 to 20 inches long at about 8 months, and by the time you're full term, they are between 20 and 21 inches long typically. What you'll notice is this puts a terrific amount of pressure on your lungs, on your intestines, and on your stomach. As you approach full term, your baby is going to drop or engage. And so the pressure will be less up in your lung area, but greater down on top of your bladder and down in your pelvis. And so remember all those trips to the bathroom that happened during your first trimester of pregnancy? You go back to needing to use the bathroom more, in particular in your last trimester, especially the last month or so, because your baby's putting a terrific amount of pressure on your bladder and it just doesn't have room to store a lot of urine. The third trimester also usually brings on the most complaints about discomfort from my pregnant students, just because you really start feeling very unwieldy. It's hard to move around. You have a hard picture, a hard basketball in your abdomen area that you're having to bend over. Oftentimes you don't get to see your toes and haven't for, several weeks. And at the same time, your hormones are really ramping up in preparation for birth to prepare your body as well as the baby. It makes it a lot harder to think. You get a lot more of the fuzzy thinking kicks in again as relaxin works to relax the tendons and ligaments in your body. It makes it harder for you to move around. You need to really be careful because it's much easier to trip and stumble. Your center of gravity has changed because of, your baby really growing, your tummy being extended, all this relaxin making it hard for you to move around. And you want to make sure that you enjoy every bit of this process, because it is much easier to be pregnant even in the last trimester, and to really let your body go through all the hormonal processes that it needs to prepare for childbirth. And it's much easier to let your baby go through all the hormonal processes it needs to for childbirth, so that you can have a really good birth experience. Your body and your baby is fully prepared. One of the things a lot of people don't realize is that it's actually the baby that triggers labor by releasing a hormone. It's very important to give your baby the chance to release a hormone and signal that it's ready to be born. In our society, there's this notion that a normal pregnancy is 40 weeks long. What's really interesting is if you look at the research and the statistics historically, before a lot of women were working and under a lot of stress, kind of a natural stress, being in an office environment, and also a lot more sedentary. But if you eliminate the last maybe 80 years and look at the statistics, the average length of gestation is really 41 and 1/7 week long. That's 41 weeks and 1 day was average gestation, with the normal range being between 36 and 44 weeks. And you can look on our site. We have links to the statistics that bear this out. So what that means is our medical profession views 40 weeks as a normal length of pregnancy, and oftentimes will start putting tremendous amount of pressure on women to be induced if they go over 40 weeks or over 41 weeks. And this really creates a problem because being induced really does kick in what we call the cascade of interventions, which lead to a cesarean, often will lead to a cesarean section, or a birth that's not natural, that requires an epidural and other interventions, all of which add up to a situation which we feel is much less healthy for both the mother and the baby. And certainly the statistics bear out that cesarean section is much more risky for the mother, and the mortality rate increases, and is also riskier for baby oftentimes. So that's just something interesting to know. And it's something we go into a lot more, tips for setting up a birth environment that's conducive to delivering a healthy baby and really having the amazing kind of childbirth that you're going to be really happy with and have wonderful memories for the rest of your life about. And it is important to remember your third trimester of pregnancy, that this is actually in the span of a lifetime. 3 months, your third trimester, is just a blink of the eye. So anyhow, one other thing that I wanted to mention here again is, medication and drugs during pregnancy. When you take medication during pregnancy, say you weigh 145 pounds and your baby weighs about 7 pounds, as you're getting close to full term, when you take medication, your placenta, there's this common thought that, placenta, as we discussed before when we were talking about nutrition, that the placenta filters out things and protects your baby from the things that are circulating in your blood. And that was a common belief for a while, but now we know that actually that's not the case at all. Many things go across the placental barrier, many medications, any vaccinations, viruses, things like that. And so when you take medication, your baby can receive up to 20 times the effect of the medication that you're taking, because you're 145 pounds and your baby's 7 pounds, but it's getting the same concentration of the medicine that you're getting, that you have in your blood, except your baby's much smaller. So this is a little bit of an oversimplification, and in reality, some drugs affect the baby more than the mother, and some drugs affect the baby less than the mother. So it really just depends on the medication and its ability to pass through the placental barrier. So really be careful, because everything that you take, you ingest, for good or for bad, can affect your baby during pregnancy. And so certainly, you wouldn't want to do any kind of street drugs, and you don't want to take any prescription drugs if at all possible, which is one of the reasons why we mentioned Neomed sinus rinses, because for many women, they're able to eliminate having to take any kind of allergy medicine for, hay fever and sinuses by simply doing a sinus rinse first thing in the morning and last thing at night. And also another thing to know is that the herb nettle, stinging nettle, just freeze-dried stinging nettle, is very helpful. So between the combination of taking some stinging nettle or making stinging nettle tea, that combined with doing a Neomed sinus rinse actually has solved the problem of allergies for many of my pregnant students, and not only during pregnancy, but actually after pregnancy while they're breastfeeding and beyond, and they've been able to eliminate having to take allergy medicine at all, which is wonderful, because allergy medicine almost always is somehow causes drowsiness. So if you can do away with having to take allergy medicine, that can be a really wonderful thing. The other thing you need to realize too is that a lot of natural drugs such as teas, herbs, food additives, household chemicals, environmental hazards, all of those things can pass through to your baby as well. So that's the reason why we keep emphasizing eating an organic diet, eliminating your exposure to any kind of pesticides, cleaning agents, any kind of toxins while you're pregnant.